Hello everyone. So from today we'll be starting a new series of videos on orthopedic. So we'll be covering everything starting from today's very basic lecture about fracture and its classification to different traumatic fracture, different regional injuries, and we will cover almost every important topic in the orthopedic. Previously we have completed the important chapters in gynecology and obstetric. You can check out in our channel. So let's move on to the first video on orthopedic. So talking about basic thing about fracture. So what is fracture? Fracture is a break in a continuity of a bone, and it can be classified according to the various type. Based on the etiology, it can be traumatic, pathological, and stress fracture. And this symbol is represented as by fracture. And the traumatic fracture, the fracture sustained due to trauma is called traumatic fracture, and majority of fracture in day-to-day practice falls into this category. And for example, fracture by fall, road traffic accident, and all. And the pathological fracture, a fracture through a bone, which has become weak due to some underlying disease is called as pathological fracture, and trivial or no force may be required to cause such fracture. And so, for example, the fracture through bone weakened by metastasis, so that is known as pathological fracture. Stress fracture, it is a very special type of fracture sustained due to the chronic repetitive injury. Repeated stress result in breakage of bone trabecula, and such fracture may not be visible on X-ray and may present as only the pain in the bone, and these are very difficult to diagnose and can be picked up in MRI or bone scan. And based on the displacement, the fracture can be undisplaced or displaced fracture. Depending on the pattern of displacement, the undisplaced fracture, these fracture are easy to identify by the absence of significant displacement. And displaced fracture, these are the fracture may be displaced. That is, so what is displacement? It is loss in alignment and contact between two fracture fragment, and we'll see in the picture. So this is the displaced fracture. There can be the displaced fracture can be shift, angulation. They can be angulation or rotation, that is twist, tilt, or shift. And usually the displacement is described in terms of the distal fragment that has been displaced. So the displacement is described in terms of distal fragment in relation to the proximal fragment. So if we say the fracture is displaced laterally, then that means that the distal segment of the fragment is displaced laterally. Okay. And on the basis of communication with the external environment, the fracture can be either closed or open fracture. The closed fracture is the fracture not communicating with the external environment, and that is the overlying skin and other soft tissue are intact. It is called as closed fracture. And in open fracture, or fracture with break in continuity overlying skin and soft tissue leading to fracture communicating with the external environment, it is called as open fracture. And it is also known as compound fracture. And the fracture may be open from within or outside. There can be two types, the internally and externally open. The internally open fracture means that the sharp fracture end pierces the skin from within inside. That is, the fracture fragment pierces the skin from inside, and the bone is used. These are found in the subcutaneous bone, like the fracture in the lower end of tibia, and that can cause the open fracture. In externally open, the object causing a fracture lacerates the skin and soft tissue over the bone, and it breaks the bone, resulting in the open fracture. And one example is the fracture of ulna due to the result of hit by the stick. And on the basis of complexity of treatment, it can be simple or complex. The fracture in two pieces are usually very easy to treat, and these are called simple fracture. For example, transverse fracture of humerus. And the complex fracture means that the fracture in multiple pieces, and they are usually difficult to treat, and it is called complex fracture. And is, for example, intercondylar fracture of tibia. On the basis of quantum of force causing fracture, it can be due to high velocity fracture. These are fractures sustained as a result of severe trauma force, as in road traffic accident. In this fracture, there is severe soft tissue injury, periosteal and muscle injury, and there is extensive devascularization of the fracture end. Such fractures are very difficult to treat, and they often are unstable and they heal very slowly. And most complications occur in this type of fracture. And low velocity fracture, these fractures are sustained as a result of mild trauma force, as in the fall while walking. For example, there is little associated soft tissue injury, and this fracture often heal predictably, and that is that. And on the basis of pattern, finally we have the basis of pattern. There can be various type of fracture: transverse, oblique, spiral, segmental, and comminuted TOSSC. Let's explain through the picture. So in this fracture, the fracture line is perpendicular to the long axis of bone. Such a fracture is caused by tapping or bending force. So this is a transverse fracture. And in oblique fracture, in this fracture, the fracture line is oblique, and the fracture is caused by the bending force, which in addition has a component of force along the long axis of bone. And this is spiral fracture. In this fracture, the fracture line runs spirally in more than one plane. Such a fracture is caused by primarily the twisting force. And this is comminuted fracture. In this fracture, a multiple fragment, it is caused by crushing or compression force along the long axis of bone. There are multiple fragments. And then this is segmental fracture. In this type, there are two fracture in one bone but at different level, and this is called as segmental fracture. And the fracture may have the combination of two or more patterns. For example, it may be comminuted but primarily a transverse fracture. So that was all. If you like, then you can subscribe to our channel. I will be coming with more topic. You can screenshot this note if you like it. And in next video we'll be talking about fracture with eponym. And orthopedic is really very interesting subject, and we'll make it more interesting. So thank you, and let's revise and read together. Thank you.